And welcome to CivicLab Toronto curriculum. The session is Community Resiliency. It is the third of 6 sessions through the City of Toronto. Before we go on, I would like to acknowledge the land that we're on. Now, as this class is virtual, so we are not sure where everyone is. I recognize that some of you may be on different territories depending on where you are located at the moment. So we are asking that you do acknowledge the territory that you are on. For us in Toronto, I'd like to acknowledge the land that we're on is traditional territory of many nations. That includes the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples. And we are now home to many First Nations, Inuit, and Métis peoples as well. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. My name is Shane Walker. I use the pronouns they, them, their, and I'm a professor in the Department of Humanities and Social Sciences at Centennial College. So as I mentioned previously, today's session is focusing on community resiliency. And as Ashton and Eisenberg describe it, community resiliency is the sustained ability of a community to utilize available resources to respond to, withstand, and recover from adverse situations. So the CivicLabTO curriculum is presented by strategic partners and the city manager's office within the City of Toronto in collaboration with 8 other post-secondary institutions, including Centennial. So I'd like to thank George Brown, Humber, OCAD, Ryerson, Seneca, University of Toronto, York University for their participations and contributions to CivicLabTO Common Curriculum. And thank you to all our partners that have made this session possible and all sessions possible. So before I pass this on, I am going to remind you that this session is being recorded. So if you do not share any personal information that you do not want to be shown. It will be available sometime during the week. So for students, your professors will pass on the various slide decks and videos when they become available. And there will be a Q&A at the end. So you can, if you wish, post questions in the chat and in the Q&A, but there will be a Q&A at the end that we will also post to the speakers of the presentations. So, so also we are generally muted. So there is no ability to unmute your mic unless you are presenting. So don't be offended. With that being said, we are going to be hearing from Manjeet Jita, who is the Director of Strategic Partnerships, Wayne Chu on Poverty Reduction, John Smith on Community Development, Mohammed Shuri, I'm mispronouncing that, on Police Reform, Nicole Welch, Toronto Public Health, and Velisa Faria on Housing. So if you could welcome our presenters and esteemed guests, that would be it. So our first speaker today is Manjeet, and I will ask her to start the presentations.
Okay. Thank you so much, Shane, and thank you for moderating today's session. As Shane said, my name is Manjeet Jita. I'm the Director of Strategic Partnerships here at the City of Toronto, and welcome to our third session of CivicLabTO Common Curriculum. So in this session, we're going to continue our discussion of equity, inclusion, and reconciliation with a focus on community resiliency, as Shane described. You will remember Deputy Mayor Thompson at our last session talked about the importance of this work and the role and the leadership of Council in partnership with the administration in advancing the city's commitment to this issue and looking at how the city operates its services and programs and how it supports equity-deserving communities. In today's session, City staff will explore how they are advancing this commitment to equity, inclusion, and reconciliation through a community resiliency approach, through the programs and strategies they lead in the areas of housing, health, community development, poverty reduction, and policing and safety. As you listen to each of the presenters, I ask you to think about, how does research inform this work, and who conducts that research? What is the role of academia and the communities that also support this work? What was the role of City Council in supporting and authorizing the work? So what happens in terms of these policies, strategies, and programs as they go through council processes and city staff administration? Where did the city need to work with and negotiate with other jurisdictions and other orders of government to advance the program goals? And how have staff engaged community in a meaningful way? I think these are questions you may want to think about as our speakers present, and look at your questions that you might want to pose to them. You have an esteemed group of presenters today, many of whom I have had the honor to work with directly. They are content experts in their field, but they also have some key skills that allow them to be successful, some of which include their ability to be agile in complex, ever-changing environments, their ability to partner internally and with external groups and build strong, trusting professional relationships. They are innovative and creative. They look for opportunities and new ways of working, and they are critical problem solvers. They engage community in meaningful ways in the policies they develop and the programs that they lead, and they put equity, inclusion, and reconciliation at the center of their work. I ask you to think about these skills and capacities because they are ones that you may also want to develop for yourselves as you look to get into the world of employment and maybe even working for the city one day. With that, I'm going to pass it back to Shane to introduce your speakers for today. So have a great morning.
Thank you, Manjeet. So we have 5 speakers today, 6 including Manjeet, who is presenting on poverty reduction. So I will pass it on to Wayne to start his presentation, please.
Thank you, Shane. Thank you, Manjeet, for those kind words. So my name is Wayne Chu. I am the manager of the Poverty Reduction Strategy Office at the City of Toronto. My pronouns are he and him. So really happy to be able to speak to all of you today. You know, I think as Manjeet talked about, we're big believers in collaboration, especially in this work, and that includes you know, engaging folks like you who you know are it sounds trite, cliche, future leaders, but you know, it's important, I think, that we're all thinking about, you know, how many of these issues that we study, many of these issues that we hear about manifest themselves practically and concretely in a place like Toronto. So I have the honor of being able to lead the Poverty Reduction Strategy Office, and love to tell you a little bit about that today. So before I get into a little bit about what the poverty reduction strategy is at the city, I just wanted to quickly go over the context of poverty, sort of to set the stage. So this is a bit of an older graphic. We used this infographic in the inception of our strategy in 2016. So it is a little bit older data. But the thing is that when we look at more recent data, it actually hasn't changed all that much. Poverty is, you know, it's a big issue. It's intractable. It is something that we are, you know, that is not something that will be solved with a silver bullet. And you know, the magnitude of it is daunting, but it's also important to address because of how many Torontonians live in poverty. So 1 in 5 adults live in low income, and it's not evenly distributed among all of our residents. So, you know, poverty is more likely to occur in certain communities. Poverty is racialized, gendered, is geographically concentrated in the city. And so, you know, we explicitly consider our poverty reduction strategy to be an equity strategy. So what is in our poverty reduction strategy? Well, a lot of things could go into it. Our strategy was developed over a course of a year and a half with multiple rounds of community engagement. We engaged folks with lived experience as resident leaders and facilitators to include people who, have a stake in this policy document in the decision making of the city. And the things that we heard was that poverty is about a lot of different things. And so we've identified in the strategy 6 specific themes or areas of intervention that inform the actions and activities that we take. All in all, we have 17 recommendations, and you can find more about them at toronto.ca/poverty reduction. But generally speaking, they are in these buckets. So, we have housing stability. So we're looking at, the affordability and the quality and the supply of affordable housing in the city. This is probably one of the biggest issues in Toronto, as in other jurisdictions. Everyone's heard about the lack of affordable housing in the city, and that's why the city has a dedicated housing strategy, which you'll hear about later. Our friend Valessa will be talking about that a little bit later in the program. In terms of service access, we're looking at ways to not just provide more or better quality services, but how do we deliver supportive services to folks who are in poverty in a more seamless way? One of the things that you often see is that people who are in poverty constantly have to prove that. And so how can we create a system that is seamless, that is trauma-informed, that reduces burden on people who are asking these services, but also importantly, and in terms of partnerships, how do we do this in a way that works seamlessly across jurisdictional lines, whether it's healthcare or the provincial government or the federal government, so we're not sort of just passing people off to other different counters or services, saying it's not our problem. Transit equity is also a big issue. How do we get around the city? People who are in poverty are often significantly more transit dependent. And so, we have a key flagship program of the poverty reduction strategy, the Fair Pass Transit Discount Program, which offers folks who are in low income with a $1.10 discount on single ride fares and $22 roughly discount on monthly passes to try to make transit a little bit more affordable. Food access is important, food security. Actually, with COVID and the pandemic, we've seen the lack of resiliency in the food security system, people going hungry because of the lockdown or being isolated, closures of services or altered services that reduces access to places where people would get food, and also the increasing the supply chain issues you see in the macroeconomic environment in terms of increased costs of food and making it hard to actually be able to afford nutritious food. So those are things that we're tackling as well in the strategy. Employment, quality jobs and livable incomes is very important as well. One of the largest community social services that the city delivers on behalf of the province is Ontario Work Social Assistance. So how do we make sure that that program is delivered in a way that that improves employment outcomes, that improves life stabilization, that enables folks to get out of poverty rather than be trapped in a cycle of poverty? But also, and then the 6th theme is systemic change, which is the biggest one, but also in some ways the most important one, because poverty is systemic. Like I said, poverty won't be addressed by a silver bullet program. It's reforming systems so they work better for everyone. So that's things like inclusion in decision making, funding poverty reduction programs, but also leveraging the economic power of our institution and other institutions, such as the post-secondary institutions that exist in this city, to leverage their economic power to invest in communities that have historically been economically excluded. So there's a lot there. We're currently in an action plan which has 42 actions and a number of activities there. But you know, all of this work is we try to inform this work based on what the city can actually do. Obviously, there are jurisdictional lines. There are some things we can and cannot do. We've identified in the poverty reduction strategy 6 specific levers that we're focusing on. You can see them here. I imagine the slides will be sent out and you can review them more. But you know, all this to say is that it's important to call out the issues, but it's also important to be intentional about what is it that your place in the ecosystem can actually do, whether it's providing services, developing policies and regulations, funding organizations, community organizations, using the fact that we're a municipality and the government to provide leadership or stewardship for partners in the community and other stakeholders. And then, like I said, thinking about also our economic impact, whether through purchasing or through other measures. So we're staff. We're doing this sort of through the mandate of the poverty reduction strategy, which was approved by council in 2016. But we do, in some ways, poverty reduction, well, in many ways, poverty reduction is political. And so we do engage council on a regular basis, and they do have an interaction with us on how this plays out. So it's a 20-year strategy, but it is organized into a series of 4-year term action plans. So every new term of council after they're elected, early in their council term, we put forward a new action plan for them to adopt, and that defines the work plan that staff will be working on over the next 4 years. We also update council on a regular basis through annual budget briefing notes. So every single year, there's a poverty reduction budget briefing note that summarizes the investments that the city is making in poverty reduction. In the middle of every term of council, we provide a status update report to executive committee where the executive committee can make comments, ask questions, if they so choose to change directions. And as an equity strategy, we also have started to report regularly to key council advisory bodies. So these are subcommittees of council that are focused on various different issues and communities. So we provide a regular update to Aboriginal Affairs Advisory Committee, the Toronto Accessibility Advisory Committee, and most recently the Two-Spirit, Lesbian, Gay, Bisexual, Transgender, and Queer Advisory Committee as well, as an opportunity for representatives of those communities to comment on the progress of the strategy. So there's a lot there. I could talk about this for hours, but we have plenty of engaging topics and speakers. But that's the poverty reduction strategy at the City of Toronto. You can reach our office at PRSO at toronto.ca, our website, toronto.ca/poverty reduction, and I look forward to answering your questions.
John Smith, who is Community Development with the City of Toronto. John, over to you.
Thank you. I think my presentation will be shared in a moment. Go. So thanks, Shane, and thanks, Manjeet, for a really fantastic intro. I want to talk in my presentation. I want to talk about the work I do in social development finance administration, and I'm happy to have my colleagues Wayne, Chu, and Mo on the Shuri on the presentations as well, because a lot of our work that we do in our division intersects. So next slide, please. So the agenda for my presentation will cover my role as manager of community development and a number of key plans and initiatives that we're involved in, mostly centered around the city's emergency response to COVID-19, and but we'll also touch on community planning and some community planning strategies and initiatives. Next slide. So I have the pleasure of being manager of a community development unit since 2015. The community development unit is one of 6 units within our community resource section, which is one of 4 sections within SDFA, Social Development Finance Administration. And our priority is the implementation of place-based strategies. You may have heard of a strong neighborhood strategy, or you may have heard of priority neighborhoods, now termed neighborhood improvement areas. We're also involved in community planning strategies, the social development plans, in partnership with Toronto Community Housing in Lawrence Heights, Regent Park. There are other revitalization and social development plans, but those are a focus for our unit. And we also support interdivisional initiatives, and that's partnerships with energy and environment for the climate action funds and Pollinate TO, and working in partnership on a new initiative in Jane Finch with city planning and economic development. And in my role, I'm leading a number of teams. I will speak more about the community coordination plan and vaccine equity team. And we are also very lucky to have an investment called Partnership Opportunities Legacy Fund, which saw $12 million invested into 37 small capital projects as part of the Strong Neighbors strategy, but it's taken on a life of its own in terms of completing those projects with other city partners. And as well as manager, the regular team meetings, but also staff direction in terms of evaluation, training, and planning. The team is composed of positions that we have, project manager positions. We have a half of supervisor. We haven't had a supervisor for a while, but we were fortunate to get one on loan, at least 50%. Program support staff, as well as the majority of our staff are management, which are community development officers. And we do have community development workers, and we support and manage the Keel Community Hub. So in total, 2 teams and a lead area, as well as in total 29.5 staff I have reporting to me. Next slide, please. So the community coordination plan was basically built out of a response in March of 2020 from organizations that wanted to ensure that residents, the more vulnerable residents of the city, were supported through COVID. So this is a brand new, in a sense, brand new initiative that is about 18 months old. We're working in partnership with the United Way, and we created a platform that helped in terms of not only rapid response, but collaboration with nonprofit organization partners, grassroots groups, but mostly nonprofit organizations across the city. The ones that were available were were able to help us in terms of collaboratively looking at how to respond to the needs of communities. And so we established 12 clusters. Clusters are more regional areas where we have these teams or tables of organizations. The clusters can range in size from 15 to up in excess of 40 organizations. Overall, we have 400, we're working with 400 plus organizations As of last, I think these numbers are from last year, January, we're able to allocate at least 1.5 million directly through the community coordination plan, as well as donations in excess of a million personal protective equipment items. And we are fortunate as well to invest during this time into initiatives, community-based initiatives like neighborhood pods, climate action fund, some community grants, as well as support of our clusters by having cluster communication leads added to sort of the support. And those leads were hired by our cluster organization partners with support from the city. Next slide. So the community coordination plan is kind of our base platform. And on our base platform, we added on another specific, level of funding through what's called the Equity Action Plan. Last year, 2020, funds were approved for organizations to work in specific hotspots based on public health information, to focus on supports to families and specific population groups. And so we identified 12 lead organizations, and they're focused on 6 of our cluster areas. You'll see them listed at the bottom there, from Black Creek Humber Summit to South Scarborough. And we have organizations that also are working on a citywide to focus on highly vulnerable residents, and as well as vulnerable residents who and community members who are undocumented. Next slide, please. So in addition to, and I'm kind of building from the platform, community coordination plan, about partnership, equity action plan, about specific investments. And so we're also supporting the community engagement and vaccine mobilization that began this spring. And this is to engage residents across the city to promote education on vaccination. And we're working with, and so we are able to develop a grant, the Vaccine Engagement Teams Grant, which provided 5.5 million to over 155 organizations, and also provide additional funding to Indigenous serving organizations. We have a Black Science Task Force, the South Asian Task Force, Accessibility Task Force. These are groups that were developed to ensure equity of engagement, of information, of access to vaccination. And finally, the Toronto Youth Vaccine Engagement Advisory Committee that was supported by the Toronto Youth Cabinet members. Now, the funding, the process was very fast moving. But it is a citywide focus. The city has identified 140 social planning neighborhoods, and the vaccine grant identified 40 sort of like consortiums, or 14 consortiums of organizations in these cluster areas working together to hire ambassadors, and those ambassadors are working on the local level for vaccine information, education, promotion, and to amplify the public health message. Next slide. So the last few slides will focus on our strong neighborhoods and other planning that preceded COVID. Right now, Strong Neighborhoods has been suspended because of our focus on COVID-19 and the emergency response to COVID-19 through the Community Coordination Plan. We'll be looking to restart Strong Neighborhoods as we come out of COVID-19. But we were at a point of completing, and we have completed an evaluation of Strong Neighborhoods. we'll be looking to learn from that evaluation, as well as learn from the evaluation of the community coordination plan, to move beyond 2020. We're already beyond 2020 and more towards a 2022 to 2032 plan for strong neighborhoods, neighborhood assessment, assessment of, if you know anything about strong neighborhoods, and I have some links at the last page. We are focused on investing in 31 neighborhood improvement areas, and these are social planning neighborhoods that have been identified for investment because of historic inequities in terms of access to services, in terms of other capital and social investments, economic investments in these areas. And so moving forward, we'll be looking at developing a methodology for assessing another assessment of these neighborhoods, as well as a plan of action for working with community organizations and groups within these neighborhoods. Next slide, please. And finally, I just wanted to highlight what's ongoing through COVID. In addition to the community coordination plan work, has been planning initiatives in Regent Park and as well as Lawrence Heights through the social development plan, as well as Jane and Finch, the Jane and Finch initiative, which is a new collaboration. We've never sort of come together as divisions, city planning, economic development, and social development, finance and administration purposely. We've kind of sometimes pulled one or two partners together for social development plans, but this was this is an attempt to look at interdivisional planning and collaboration, and also working directly with community organizations as well as community groups. There's a community advisory that's been set up for the Jane Finch initiative, and the investment is going to be, as the other revitalization investments that I talked about in Regent Park and Lawrence Heights, it's going to be a multi-year investment, but Jane Finch is a little different because it's based on a transportation infrastructure across Finch. And what's key is that we look at developing partners locally, as well as citywide and with foundations. And we have a robust approach to resident engagement that has an equity focus. And we look at developing the appropriate resources in order to, once you have a plan, you have to be able to enact that plan. And those are key areas for all of our planning processes right now. Final slide. So I'm just leaving you with a few links. You know, all my contact information is listed on the Strong Neighborhoods strategy webpage with a link to a number of the planning initiatives in Regent Park. There are other information there as well. Please feel free to follow up by email, and I'm happy to follow up with any other information or reports that you may be looking for. Thank you.
Thank you, John. Great information. We are going to move on to Mohammed Shuri on policing reform. Just a quick reminder, don't be shy with your questions in the chat. So, Mohammed, it's all yours.
Thanks, Shane, and good morning, everyone. Thank you so much for having me here, and looking forward to our dialogue and conversation. I am the manager of the city's police reform team, and I'll talk to you a little bit today about what initiated this work, what are the priorities the city is focusing on when it comes to policing reform. It's a long road where we are with this work, where have we fallen short, and where is there room for more growth. And also talk to you about a particular focus around alternative community safety supports, in particular the pilots that were adopted by council for mental health crisis calls called the Community Crisis Support Service pilot, key next steps for it. And then I hope from there we can have a vigorous conversation around this work. So can I have the next slide, please? So as some of you might remember, in June 2020, there was a lot of community organizing and public protests calling for substantive reform to policing. This followed the heels of the tragic murder of George Floyd and passing of Regis Paquette, and citizens both in Toronto and across the world called for a reform of how policing is done. And as a response, City Council had a meeting in June 2020 and adopted 36 recommendations that fall in the buckets that are on this slide. In addition, the Toronto Police Services Board, which is the governance oversight body for the Toronto Police Services, adopted 81 additional recommendations for reform in August of 2020. So between the 81 and the 36, those are the package of reforms that were adopted. The city, as you know, has certain levers and in ways to engage with Toronto Police Services Board, but ultimately the guidance and oversight is with the board. So these are areas where the city identified that from conversations with the public, that these were key areas for the city to work on and to work with the Toronto Police Services and community organizations to consider. Number one was the need for alternative community safety responses. Fundamentally, the question of what role the police have in certain calls, and are these calls not better suited for other first responders, be it a civilian-led mental health crisis team or others, is the fundamental question that council posed to city staff to go and investigate, and that's what the bulk of my presentation today will be on. Other key reforms included, as you might know, we have an interim police chief, and Toronto City Council adopted a broader community engagement plan and requested Toronto Police Services Board to engage as many community groups as possible to identify what are the key criteria for a police chief going forward and ensure that criteria is used in the selection process. And that engagement was complete, and the selection process is, I believe, still underway. Question of police budget transparency came up. Some of you might know Toronto Police Services budget was not published line by line. So one of the recommendations or directions by City Council was for the Toronto Police budget to be published line by line for all to see and download and to scrutinize, and that was made available. And then furthermore, an independent auditing and police service accountability. The Auditor General was requested, Toronto Auditor General, to work with the Toronto Police Services and do a line-by-line review and identify areas for efficiencies and areas where perhaps the services can be better delivered by somebody else. Question of data and sharing became very important in terms of use of force data. As we know from reports done by the Ontario Human Rights Commission and many other organizations, that Black, Indigenous, and other equity-deserving communities face disproportionate carding and use of force by police services. So City Council directed that this data be made available publicly. And as you might know, police conduct accountability is a key conversation that people were raising in June of 2020 and is an ongoing conversation today. You might also be familiar that all police conduct accountability falls under the provincial legislative statutes. And so as such, the city identified requests of the province, including the province amend the legislation to allow for suspension without pay. Currently, officers very rarely get suspended without pay, and both the Toronto Police Services chief and many other chiefs across the province have requested this as a tool, and the province has considered it and has not necessarily moved on it. Last but not least, City Council identified the need to take a look at all the major reports that have come out the last 10 years, including the Modernization Report, the PACER Report, the Andrew Loku report, and many others, to identify what of the recommendations from these reports have been implemented, have not been implemented, and what their status is. And that's part of the package of directions here. All this is published on the status of where we are on all this is published on our Police and Reform website, which I will share the details at the end. At a high level of the recommendations, the 36 the Council passed in June 2020, we are about 75% complete so far, but many more to complete in the next few years. And of the 81 recommendations adopted by the Toronto Police Services Board, we're about 52% complete. And again, I can share with you their dashboard at the end of the slide. So let's talk about alternative community safety responses. Can I have the next slide, please? You know, I think part of the conversation that both community advocates and residents raised is that there is a need to reimagine a crisis response. We've seen both from the 1980s and 90s deinstitutionalization and the downloading of services onto removing the way we've unfortunately housing people with mental health challenges in hospitals, moving that away and having people on their own, but not provide any supports, led to a further strain where not-for-profits came in and tried to provide that help. But on top of that, not-for-profits have not been able to receive the funding, and the social service sector has not been able to receive the funding to keep up with the demands. So as such, what we've seen is more and more people fall into distress. And when they fall into distress, unfortunately, 1 in 5 people who fall into distress interact with Toronto Police Services. And we've seen an increase in the total number of person in crisis calls, almost 32.4% to Toronto Police Services over the past 5 years. We know addressing health issues through a law enforcement lens does create service barriers, particularly for Black, Indigenous, and equity-deserving communities, and we have to re-examine what is appropriate for a non-police response. And so that's part of the work that my team and I have been leading, is to reimagine a non-police model response that's client-centered, trauma-informed, and reduces harm. And part of the work I'll share with you today. Next slide, please. Sorry, next slide, please. When I talk about non-led police, oh, the one before, sorry. When I talk about non-police-led crisis response, there already is a lot of not-for-profits doing this work, and I just want to highlight a few of them, and they might be familiar to you, such as the Gerstein Crisis Center, the Distress Centers, the Youthdale Crisis Support Team that predominantly focuses on supporting youth, the Scarborough Hospital Mobile Crisis Program Team, and then Anishinaabe Health Toronto providing 24/7 mental health crisis management service for Indigenous communities. So I don't want to make any impression that this doesn't exist. There is a lot of community engagement on a non-police-led crisis response. I think the key question the City Council asked us to look at, and other jurisdictions have already explored, is what does it look like when people call 911? How do we defer that call from having a police response to look at having a non-police response and make sure that entity, whatever it is available 24/7. And that's part of the work that we undertook with extensive community consultation, again, examining best practices like the Gerstein Crisis Center and the ones listed here locally, also examining other jurisdictions such as Cahoots in Oregon, seen as the best model, and many others, and then coming to a recommendation that we provided to City Council that they adopted in February 2020 that basically outlined a pilot approach. If I can have the next slide, please. So the city recommended that we and adopted that we test out 4 pilots, and I'm going to walk through how the pilots will look and then talk to you about where the pilots will be based. So the city, if you look on the left-hand side, the role of the city will really be to help serve as the backbone support for the pilots. The pilots will all be community-led. Our job will be to discuss intergovernmental advocacy, provide public education campaigns on the service, and identify the need for increased community investments. I talked a little bit earlier about the financial need for both, safe beds, overnight crisis beds, detox beds, access to mental health counseling and supports, and this is the role for the city to ensure that the funding is there for these critical infrastructure needs to help support people when they fall into crisis. We've engaged Find Help 201, which is a gateway to almost over 300 community organizations to help dispatch the calls and provide people connections to follow-up supports they may need. As I mentioned, we are taking a community-led model, and we will be working with 4 community-led partners that will be health service providers. So they'll be managing the mobile crisis teams, as well as providing wraparound supports and case management for people. And essentially, the anchor partners will be sending out a multidisciplinary crisis workers to calls, 2 people at all times, And these crisis workers may involve elders, they may involve people with harm reduction background, they may involve peers, they may involve nurses. The city has kept it open for each community anchor partner to identify the needs for their community. The other component is obviously evaluation. We want to know if this works and how well it works. So a key component would be working with our third party to help lead the monitoring and evaluation of these pilots and to identify key areas of growth and success so that we can move towards a citywide implementation. And since the beginning of the project, we've done almost 33 community engagements. And so a key component is going to be to make sure we have community feedback and establishing a pilot community advisory table to provide ongoing advice made up of people with lived experience of mental health and substance misuse, made up of the voices of families, made up of key service providers to provide guidance on the deployment of the pilots. Next slide, please. So the pilots will be geographically placed. There's going to be 4 pilots, one in the Northwest that overlaps with Police Divisions 23 and 31, one in the Northeast that overlaps with Police Divisions 42 and 43 that covers large parts of Scarborough, one in the downtown core, the downtown east that overlaps with Police Division 51, and a 4th pilot that's going to be Indigenous led, and the geography is yet to be determined. How we selected these geographic areas is we looked at person crisis calls, both defined as ones that involve attempted suicide, and this is the terms used by Toronto Police Services: emotionally disturbed person, LOP, jumper, and then looked at where the calls were the greatest. We also looked at the highest rates of mental health apprehension. We also looked at where there was engagement by the Toronto Police Services Mobile Crisis Intervention Team, which is a team composed of 1 officer and 1 nurse sent to calls. And we also looked at geographic equity, where there were areas of availability of mental health and supportive services, and where there was not that available, to determine where we place the pilots. The downtown pilot has the highest person in crisis calls, also the highest overdose calls. The Northeast has the longest wait times in hospitalizations for people experiencing mental health crisis, and the Northwest has the 2nd highest mental health apprehension. So we thought these would be good areas to ground the pilots in, to test out and see how well they work before we scale across the city. Next slide, please. Thank you. So responding to the crisis is important, but I'm reminded of a great quote by Bishop Desmond Tutu, who said, it's fine to help pull people out of the river, but we have to find out why. We have to go upstream to find out why people keep falling into the river. And I think this is where the question of community investments and identifying what are the challenges why people have fallen into crisis is equally as important as a mobile crisis response. So part of the city's commitment is to provide robust supports around mental health, both in terms of wraparound supports, prevention, intervention, incident response, and civilization. And through our pilot partners, we're going to be identifying what the needs are and identifying what role the city can play. I have to acknowledge that this is a provincial jurisdiction. Healthcare is a provincial jurisdiction, but we cannot sit back and wait as we see that there is great need. You may have noticed that during COVID-19, the city has supported the mental health sector with almost $2.9 million in direct support for agencies providing supports to people in need. And we will continue this work and continue to identify the gaps and the areas where people need support. And this is just to highlight some of the key areas of community investment the city will continue to work on. Next slide, please. So I think, the pilots haven't launched. The goal is to launch the pilots in Q1 of 2022, the first 2 pilots, and then all pilots will launch by Q2 of 2022. So by June of next year, all 4 pilots will be available, and they'll be operating in their different geographies. If the pilots work well, the goal and council's intention is to identify what it costs to support a full citywide implementation across the board and to fully staff it. We are the first jurisdiction in Canada that's moving ahead with this piloted approach. Others are examining our approach and will be rolling out their own pilots. Our work has been summarized in the document below that you see the community report, which is available on our website. And then more information on the overall policing reform actions, the status of each of the actions, what work has been done, what work has not yet been done, what's in progress, is available on our dashboard. I just want to conclude by saying that policing reform is not going to be an overnight project. It's going to be an ongoing project. But one thing that has been important about this work is the constant community engagement, and that's going to be very critical going forward to ensure that there is scrutiny and engagement on making sure that we arrive at truly reforming Toronto Police Services and other institutions and provide greater capacity for alternative community safety responses. Thank you very much.
Thank you, Mohammed. So we're going to switch gears a little. We're going to hear from Valessa from the Housing Secretariat, and then Nicole afterwards. Go ahead, Valessa.
Thank you, Shane, and good morning, everyone. I'm Valessa Faria, pronouns she, her. I'm the Director of Housing Policy and Strategy in the Housing Secretariat at the City of Toronto. So the Housing Secretariat at the City of Toronto is responsible for overseeing the delivery of all housing policy and programs that deliver new housing that protects existing housing stock. And we also work closely with our federal and provincial partners in terms of allocating funding and resources to the City of Toronto to support residents who are in housing need. Next slide, please. So I'm going to start off this morning by giving you some context of the current situation in Toronto as it relates to housing. So over the past decade, housing costs have grown faster than incomes in the city. And this is due to a number of factors, including the shortage of purpose-built affordable rental housing. So about 90% of our housing stock was built prior to 1990s. So there's been decades of underinvestment in housing from all levels of government. Currently, there are about 194,000 households paying more than 50% of their income on rents. There is a need to respond to this pent-up demand while also preparing for significant increased demand over the next 10 years. So by 2030, we're anticipating an increase of about 1 million people in Toronto. The number of seniors aged 65 plus will grow by 59% or 700,000, which is quite a large number. There will be a demand for more supportive housing, and this is affordable housing with wraparound support services. So this is some of this wraparound supports that Mo just talked about in his presentation. And we'll also see about 500,000 people, additional households, that is, living in low-income housing by 2030. So a really, really challenging situation. Next slide, please. So what has the city done? In December 2019, City Council approved the Housing TO 2020-2030 Action Plan. So this is the city's 10-year housing plan. It's Canada's first human rights-based housing plan. And it's really the city's umbrella document or blueprint for addressing the full range of housing and homelessness needs across the housing continuum. So you'll see the diagram of the slide shows the full housing continuum, and it starts all the way from emergency shelters and it goes to homeownership. So most of our efforts at the city are currently, while we try to address the full range of needs across the continuum, our focus is currently dealing with residents who are currently without homes or those who are living in unsuitable housing or what we call core housing needs. So that is households who are paying too much on rent or their housing is in poor condition. Next slide, please. So this slide gives a high-level overview of the 13 major key strategies in the housing plan. So how will we address the full range of housing needs across the next 9 years? So I'm not going to go over the whole list here, but maybe I'll point out some of the key areas that we will be focused on. So we will be focused on enhancing partnerships with Indigenous community partners to really increase access to housing for Indigenous peoples. And you may have seen last Friday at City Council, a report was adopted, a staff report was adopted, which really solidifies the city's partnership with Indigenous organizations to build new housing. So through that report, the city committed to working with Indigenous partners to build about 5,200 new homes over the next decade. The plan is also focused on providing pathways to support women. We know women are many times invisible in our homeless counts due to many factors. We also know that women-led households are some of the lowest income households in our city. The plan also focuses on the need to prevent homelessness and improve pathways to housing stability. And another key area is continuing to revitalize neighborhoods across the city. So as mentioned in my on the first slide, most of our housing stock was built before the 1990s and are at that point in the life cycle where major capital repairs need to be done. And we're also using this opportunity not only to modernize neighborhoods, but also to incentivize and create new housing opportunities. Next slide, please. So the Housing TO Action Plan, it's a huge commitment, or requires a huge commitment from all levels of government. The plan is estimated to cost over $25 billion, and you'll see here what's required from each order of government. So you'll see the city itself will need to invest almost $11 billion over the next 9 years, the federal government almost $8 billion, and the provincial government almost $7 billion. Next slide, please. So in implementing the Housing TO plan, we need strong collaboration with our partners. So that includes the federal, provincial, and regional governments, our nonprofit and private sector partners who will help us to build and operate our housing and maintain existing housing for residents. We also need our healthcare partners, including hospitals, to help us. So there is a need for increased supportive housing. Many people experiencing homelessness have quite complex needs, and we really see that there's a need to bring not only housing, but a range of support services to help people maintain the housing and live stably over long term. The housing plan is also focused on working closely with Indigenous communities, as well as our Black communities and other racialized people, seniors, youth, and we're also focused on building housing for essential workers. So we saw during COVID, some of the people most impacted included our essential workers, many of whom live in low-income racialized communities across our city. And of course, delivery of this plan requires all of the residents across the City of Toronto to support our initiatives. So for instance, when we were building new housing projects in neighborhoods, we really need the community not only to support these projects from a planning perspective, but to welcome the new residents who move into these homes. Next slide, please. So while the housing situation was quite challenging pre-COVID, we've certainly seen through the pandemic that these challenges have been amplified as a direct result of the pandemic. We've seen, for instance, people who are utilizing our shelter system being most impacted because of the congregate settings. We've seen encampments popping up more and more across our city because more people are experiencing homelessness due to many factors, including job losses, precarious income. We have also seen, again, in terms of the homeless population in our city, an overrepresentation of Indigenous, Black, and other racialized people. So homelessness and housing instability is very much a racialized issue that also impacts our Indigenous partners and Indigenous peoples. Next slide, please. So as mentioned, due to the pandemic, there's an urgent need to expedite delivery of our 10-year housing plan. So what we've done was during the pandemic, we worked with our federal and provincial partners. We worked with city divisions and agencies, and we really had to move quickly and mobilize to expand our shelter system. So because of the pandemic and physical distancing requirements, for instance, essentially we needed to create 3,000 new spaces in our shelters, which has been quite costly. We also saw, again, the number of people experiencing homelessness increase. So as of the month of August, there are about 84,000 people experiencing homelessness each night in our city. So quite a staggering number. As mentioned before, a lot of issues related to homelessness and housing instability have been amplified due to the pandemic, due to job losses. And currently, there are about 35,000 households who are in rental arrears and potentially at risk of evictions. And while all of these challenges have continued to grow, the Toronto real estate market has also continued to grow, and housing is becoming more and more expensive. So the need for not only for the city, but for other levels of government to respond in a meaningful way and an effective way is also top priority. Next slide, please. So this slide really shows that emergency measures are costly. So we've seen it during the pandemic again. We have had to increase capacity in the shelter system. And if you look to the left of the slide, you'll see the cost of providing an emergency shelter bed pre-COVID was about $3,000 per month. And during COVID, that has essentially doubled. So quite a staggering number. And if you look to the right, where we show improved health and housing outcomes due to providing permanent stable housing, the cost is substantially less. So this really makes the business case, I guess, it really shows the economic imperative for governments to focus and pivot from emergency measures to permanent housing. Next slide, please. So I'll go through some of these slides briefly. The following slides will provide a high-level highlight of some of the key affordable and supportive housing policies and programs that we have expedited as an urgent need to respond to the pandemic. Next slide. So modular supportive housing. Many of you have probably heard of our modular supportive housing or seen articles in the paper. So at the onset of the pandemic in April 2020, City Council approved the Toronto Modular Housing Initiative. And this was really to expedite the delivery of good quality permanent homes with support services to help people successfully exit homelessness. So what is modular housing? Modular housing is essentially built off-site and then transported on-site for assembly. So it's a faster and more cost-effective construction option than regular conventional construction methods, which take on average 3 to 5 years to build new housing. Our first two modular housing projects at 11 Macy and 321 Dover Court were opened in December 2020 and January 2021 respectively. So you'll see there from the time council approved the project to opening was within about 8 months. So quite an expedited approach to delivering permanent housing. And work is currently underway through the Housing Secretariat to deliver over 300 more modular homes over the next 6 to 9 months. Next slide, please. So these are just some images of the new modular homes that were opened. So these are some photos of the first site at 321 Dover Court Road. Next slide, please. So these are what the modular homes look like inside. So they are self-contained units, meaning everyone has access to their own kitchen. There's a kitchenette there. There is a full bathroom. We provide a bed. You'll see we also provide a full-size fridge, a microwave, a hot plate, as well as these buildings have 25% of the units being accessible. So these modular homes have been, I would say, a really effective and dignified way for the city to provide good quality housing for people experiencing homelessness. Next slide, please. So in addition to modular housing, the city also, working with various divisions, implemented the Housing and Homelessness Recovery Response Plan, which was adopted by Council in October 2020. And this is really a plan that expedited the overall 10-year housing action plan. And the main aim of this plan was to create 3,000 permanent homes that included about 2,000 supportive housing units and 1,000 affordable units, meaning these are units for people who do not require supports and can easily move out of shelters or street homelessness into permanent housing. And this plan is really focused, again, on pivoting from emergency measures to sustainable long-term solutions that improve lives, specifically for vulnerable and marginalized residents across the city. Next slide. So this slide just shows what the city wants to accomplish. Again, out of the 3,000 homes, 2,000 are supportive housing and 1,000 are just regular affordable housing. So I'm happy to say that because of federal and recent investments through the Rapid Housing Initiative, by the end of this year, we're on track to deliver 1,000 permanent homes through acquisitions as well as modular housing. By Q1 2020, we'll have another 300 homes coming online, and the federal government has just committed an additional $132 million for 233 new homes next year. So we are well on our way to delivering on this 2-year plan, but additional commitments from the federal and the provincial governments will be required in 2020 to meet our objectives by the end of 2022. Next slide, please. So I'm not going to go into the details, but this is the Rapid Housing Initiative that I mentioned. So this was the federal investment that has helped us to really fast track new permanent housing due to acquisitions and modular homes. Next slide. So in addition to modular housing and acquisitions, the city is also activating its own land to deliver a range of housing. So currently under the Housing Now program, there are 17 city sites that are really large sites close to transit where we're delivering mixed income complete communities. So that includes not only affordable housing, but also market rental housing, ownership homes. We're also building new community facilities. And the new residential units that are being delivered range in various sizes and typologies. So here we see the city leveraging the value of its land to develop affordable housing. How the model works is essentially the land is offered under a 99-year lease agreement at nominal cost to developers, and that land value is essentially used to build affordable homes. The next slide, please. So this slide just shows what we've been able to accomplish at some of the Housing Now sites. So these are some of the first 4 sites that have been on the market or currently on the market, and you'll see just the range of community facilities in addition to the housing that was built. So for instance, you'll see new childcare facilities, you'll see new public streets, you'll see increased access to the TTC, for instance. So again, this program is really focused on building successful, complete communities near transit. Next slide. So in addition to the Housing Now initiative, which activates city-owned lands, the city also operates the Open Door program. So this program essentially provides city financial incentives to developers, both private sector as well as nonprofit developers who want to build affordable housing on their own land. So we provide things like a waiver of development charges, building permit fee waivers. We also fast track the planning approvals for these projects to incentivize the private and nonprofit partners to build new housing on their sites. Next slide, please. The city is also in the process of implementing inclusionary zoning. So there will be a staff report going to the Planning and Housing Committee and Council over the next couple of months to recommend an inclusionary zoning policy. So this policy would essentially require new residential developments to include affordable housing units as part of the new developments. So keep an eye out for that. I'm sure there'll be a lot of public interest over the next few weeks as this report comes to council. Next slide, please. So in addition to inclusionary zoning and all of the other programs and policies I've mentioned, the city is also working on a new definition of affordable housing. So during the consultations for the 10-year housing plan, we've heard residents say that the city's current definition of affordable is not affordable. So our current definition of affordable rents is essentially 100% or below of the Canada Mortgage and Housing Corporation's average market rents. So what that does is it looks at the average rents across all zones in the city, and each year in November, CMHC updates that number. So what we found was, because of course the cost of housing has grown faster than incomes, there has really been a divide or disparity between people's incomes and what they can afford, and it's been increasingly challenging for low and moderate income households to afford to live in our city. So this new definition of affordable rents, affordable housing actually, will be also coming to the Planning and Housing Committee and City Council before end of the year. And this will be, we will be recommending an income-based model as opposed to a market-based model in terms of defining affordable rents in our city. Next slide, please. We are also working on a vacant homes tax in the city. So you may have seen a few months ago, council approved an initial report, and staff were directed to report back before end of the year on an implementation plan for vacant homes tax. So that is also expected to come to council before end of the year. And this is really to deal with some of the issues that have become, I guess, more visible over the last number of months, specifically due to the financialization of housing. So the intent of this is really to increase the supply of homes by disincentivizing owners who own more than one home, or keeping units vacant to bring those homes on the market. Slide, please. So what does success look like for the city in terms of our housing and homelessness situation? So I'll just go through the slide very quickly. So by the end of 2022, we are hoping to meet our housing and homelessness recovery plan goal of 3,000 permanent opportunities by end of 2022. As mentioned, we're on track currently to deliver about 1,250 homes. And with some current investments from the federal government, it's closer to about 1,500 right now. By the end of 2022, by moving 3,000 people experiencing homelessness into permanent housing, we'll be reducing overall population risk due to the pandemic. We will also be not only helping people improve outcomes, but also reducing costs for the public sector. As mentioned before, homelessness and emergency responses are quite costly as opposed to dignified permanent housing solutions. We'd also be looking to increase employment opportunities due to investments in housing. And by the 2030, which is the end of our 10-year housing action plan, our hope and our objective is to have the plan fully funded by all three levels of government. Our plan is to have chronic homelessness eliminated, and this is an objective by all orders of government. So to really meet this ambitious objective, working closely across not only across governments but across sectors will be critical. We'll also see about 341,000 households in good quality, stable housing if the plan is fully funded. We'll see improved health, housing, and socioeconomic incomes, especially for marginalized and vulnerable populations. And we will see a more resilient housing and homelessness system if this plan is fully funded. So that concludes my presentation today. I know that was a lot, but housing is very complex and there's a lot happening, and we need to do a lot more in order to effectively respond to an increasingly challenging situation. So I thank you so much for your time today.
Thank you, Vanessa. Yes, that was very informative. It's great to see what the city is doing. Our final speaker is Nicole, and she is going to be speaking about public health, and she's from Toronto Public Health. Nicole, if
Great, thank
I
you
will
so
pass it on
much.
to you.
I hope you can hear me okay. There's some construction happening outside my home here, so just let me know if I need to speak a little bit louder. Thank you for inviting us today. I'm filling in for the manager that was going to be presenting today, so I'll go through very quickly because I know we're short of time here, and to just share some examples of community engagement work that we've done throughout the pandemic and as well previous to the pandemic. So the first example we wanted to talk about is the, sorry, I just need to advance my slides here as well, is the COVID-19 and the social determinants of health community consultation report. So we took on this work last fall, 2020, and we had a COVID outreach rapid response team. And as part of that work, we connected with the community to find out how best we could support the community as a city, a whole of city response to the COVID-19 pandemic. Next slide, please. So you'll see here that some of the areas that were identified as through the community consultation really tackled some of those core social determinants of health that are just exasperated and highlighted throughout this pandemic. And very important work that we're focused to respond to COVID-19 and to support community as best as possible, but work that needs to continue on into the future. So you'll see the areas there. I won't go through all of them, but I'm sure you're quite familiar with them. And we did hear some excellent feedback from the community and to work with the city to develop strategies that could be used in the long term. Next slide, please. So some of the recommendations to address the needs immediately or the short-term actions that were identified were to create a more accessible public health information, build community agency support, increase community testing and access to health, care and health information, advocate for income supports and eviction protection, support effective isolation. So we did see that there was the Toronto Voluntary Isolation Center to support people, and that is still in existence. Overdose prevention and harm reduction work was identified and necessary, supporting people experiencing homelessness. So these were the short-term actions that the city did integrate into their response in order to ensure people were protected as best as possible throughout the pandemic. Next slide, please. So some of the long-term actions we heard is, and some of the feedback, and these are direct quotes from community. The first one is, if we actually cared, then we would be implementing the strategies that we have talked about for years. Then when we hit a pandemic, a lot of the issues are not issues anymore, so we can actually keep people safe. And this is very true. This is, ongoing. If we were in a better state as a society, we would see those that are, low socioeconomic status, people experiencing racism and discrimination would have been in a much better place. So I think this is criticism and feedback that all of us take as government and agencies providing support for the community. That is really important. So all this great work that we've been doing throughout the pandemic needs to carry on into the future. Next slide, please. The feedback that we did receive from community was included in the TO Supports COVID-19 Equity Action Plan, and we did see significant work with community ambassadors. With our other city division, we work closely with Social Development, Finance, and Admin, took the lead to pull together these equity action plans, incorporate the feedback from community, and really do comprehensive wraparound support with community agencies, government, and different levels of government throughout the pandemic. Next slide, please. Another quick example, and I know we're getting very short on time here, is the work that Toronto Public Health has done with the Indigenous community, working on the Toronto Indigenous Health Strategy. This is work that I would say in my 20-year career at Toronto Public Health is the piece of work that I've learned so much from, grown personally from, and really so meaningful to my career and working with the community. Next slide, please. A key part of this work was to work with the Indigenous community and really incorporate the operating principles and the vision and mission of Indigenous health in Indigenous hands, and nothing about us without us. So the role of the city and the healthcare agency that supported this work was to provide advice and expertise related to our knowledge related to health, healthcare systems, services, and how best we can support community. The expertise and the knowledge of their health and understanding areas where they can work together as a community to improve was from the Indigenous community. So it was really taking a not knowing stance, working with the community and listening and hearing and really trying to understand and support. Next slide, please. So some of the actions that were identified that were specific for Toronto Public Health as a result of the Indigenous Health Strategy was working to advocate for affordable and healthy food for Indigenous people, support programs that address violence in Toronto's Indigenous communities, expand culturally secure parenting support programs, and supporting new and existing public health promotion in a variety of areas that would address the social determinants of health. This was important work that Toronto Public Health engaged in, and we had to start with doing some cultural competency training within the organization and trying to integrate the principles of the strategy throughout our programming at Toronto Public Health to ensure that we had welcoming spaces for the Indigenous community and that we were culturally appropriate and supportive at all times and as best as we could be. Next slide, please. As part of this journey, we did an implementation review and we did hire an Indigenous consultation and project management firm that came in and looked at all the work that we did in order to try to meet those actions and integrate the operating principles into the work of Toronto Public Health. And some of the key recommendations that came out of the review was to hire an Indigenous senior advisor to oversee the Toronto Indigenous Health Strategy implementation, and really, to start our journey of decolonizing Toronto Public Health and other city divisions and services in the long term, which is, very tough work. Arrange Indigenous cultural safety training for the Board of Health. So this is the board that Toronto Public Health reports up to. And continue to invest in staff cultural safety training, implement an Indigenous cultural safety framework at Toronto Public Health, engage all of TPH senior management to further define and act on the operating principles, explore mechanisms to ensure that Indigenous communities' interests are represented at the Board of Health, and review TPH hiring practices to recruit, retain more Indigenous employees. Next slide, please. Oh, okay. I think, okay, sorry. I think the next slide got cut off there, but thank you very much. I'd just like to say, as far as the work that we did in implementation review and the key recommendations, one of the key things that we were successful in is hiring an external consultant to review implementations strategy at Toronto Public Health, and we continue to do that work. And we've had the opportunity to form some key engagements throughout the pandemic in order to support the Indigenous community in their response to COVID-19, vaccination rates, testing, etc. Thank you very much.
Time for a few quick questions. I know there were some happening in the chat itself, and most of them have been answered. There was one that I saw that I'll double check if it was answered that had to do with students. And given that this is a presentation for students, it seems to be, I guess, a most appropriate and pressing question in terms of it. Let me just give me a minute. So there's a shortage of affordable housing in Toronto for students overall. So what is the city doing to provide students with safe and affordable housing? Was the question. So I'm going to assume Valessa on this one.
Thanks, Shane. Yes, I just responded in the chat.
Oh, sorry, I apologize.
No problem at all. Maybe I'll just give an update on my answer. So the city, we're currently working with representatives from our academic sector table, so representatives from all of your organizations. We'll be setting up a working table. We've heard loud and clear that students as well as faculty need more affordable housing options in the city. And the intent of this working table would be to find ways where we can collaborate to increase access to affordable housing. So as an example, many of our colleges and universities are planning to are in the process of master planning for their sites. So as part of that process, we can include some affordable housing potentially as part of that master planning work. We could also look at pairing up our academic partners with a nonprofit and private sector developers that we work with to increase access to housing. So there are many opportunities, and I think as a group, we want to collectively look at what makes sense and what we can do together over the next 10 years, again, or 9 years at this point, really understanding that that student housing is an important part of our objective and as part of the housing continuum.
Thank you. And sorry, to add to that, I guess one final question I'm thinking to wrap up. What we've seen is that there's research that shows those who are young, and so youth, and that pretty much defines most of the students here, are all more subject to higher levels of poverty, higher levels of depression, higher levels of suicide. How is that playing out in the city? Like, do you have any data that shows that that demographic is much more affected by any other demographic in terms of poverty rates, suicide rates, depression rates?
Yeah, I guess I can speak to that a little bit really quickly. So I think historically, when you see sort of the interventions, you've seen a lot focused on historically on senior poverty. You've seen a lot focused on like family and child poverty, and so the federal and provincial governments and even the municipal government has spent a lot of time in the past, developing interventions for that. What we're actually seeing, especially through our social assistance caseloads, is increasing rates of poverty for people who are classified as single, which would include, for example, many students. Not all, but many students. And so with that, as you've indicated, we're seeing increased complexity and issues in terms of mental health, in terms of access to support, lack of access to networks. So that's sort of the, from the Poverty Reduction Strategies Office, that's really sort of where we're starting to focus our attention, because that's really, I think, the policy gap that exists right now.
Sorry, can I ask one other question in terms of that? Does that have anything to do with, say, the voting element or the population that has power or less power? like, so we're shifting the focus, but why has it taken, it seems to have taken such a long time to shift the focus?
Yeah. You're like, that's a political question, Shane.
That's fine. No, you don't have to answer. I was just curious.
No,
that's just
but
the politics
I think it would be fair to say that, I don't think it's disputable that demographic groups or communities that participate more in the political system get more attention. I think that's not really a controversial thing to say. So, I think you could read into that what my thoughts are.
No. It's I think as instructors, professors, we do encourage our students to vote, and hopefully they vote and do what and participate in the civic life of our cities and our province and our country. So, but yeah, so it's so hopefully they do. Thank you, everyone. I don't believe we have a time for questions. It is 11 o'clock at the moment. I believe any unanswered questions. Oh, sorry, Nicole, go ahead.
Oh, no, I was just saying bye because I have to jump to another meeting. Sorry, Shane. Thank you very much.
Bye. Thank you, Nicole. So thank you, everyone, for participating, and thank you to the fantastic speakers and presenters today. It was a great session. And for those that supported the strategic partnership, Rihanna, Jeff, fabulous session. So next session will be on October 22nd. So mobility and public transit will be discussed overall. And there is a CivicLabTO academic summit on November 23rd and 24th that is happening. So I encourage you all to participate in that as well. For my students, we have a Zoom meeting next, so I know your day is not done yet. For other students, whatever your professors have arranged is what you will be doing after this session is ended. So thank you all very, very much. It was fantastic. And until next session.